We have with us Professor Bancha from Thammasat University Hospital, Bangkok. Dr. Bancha did his MBA in 1995 from Sri Raj Medical School, Thailand. In 1996, he completed his internship in Faculty of Medicine, Thammasat University, Thailand. In 2000, he completed his residency training in orthopedics from Sri Raj Hospital, Bangkok. In 2003, he completed his fellowship in sports orthopedics and certificate in sports orthopedics from Germany. In 2004, he completed his fellowship in shoulder surgery, University of Würzburg, Germany. He also has a certificate in shoulder surgery from Würzburg, Germany from 2004. He did his DR Medical from Technical University of Germany. Dr. Bancha has responsibilities for both undergraduate and postgraduate training and education at Faculty of Medicine at Thammasat University, Thailand. A quick run through regarding the agenda for the day. We will start our session with Professor Bancha talking about the current trends in reverse shoulder arthroplasty in Asia and other parts of the world.
Good afternoon. I'm Dr. Bancha Chunchujit from Thammasat University, Bangkok, Thailand. Thank you, my two fellows, Dr.Arrisna and Dr. Posawat, for preparing the information for today. And thanks Simple Biomed and all the organizing committee for inviting me today. So I'm talking about the current trends in reverse shoulder arthroplasty in Asia and other parts of the world. So before talking about the future trends, we need to talk about the history first. So in 1970, Professor Charnier is the first one who developed the reverse system. But unluckily, his Mark 1, 2, 3 was all failed because the constraint hypothesis that lead to glenoid loosening and instability. So in 1991, Dr. Paul Gamont, he claimed to be the father of reverse. So he had the successful reverse shoulder arthroplasty and have a very good outcome. He still have some problem about the glenoid. The new problem is the glenoid loosening because of the notching and the limitation of the shoulder motion after that. So after that, 1998, so that's the new era of the reverse shoulder arthroplasty. So now we are investigating and solving the failure from the past. So this is a new era of the reverse Grammont until now. The design was developed to overcome the scapular notching to improve stability, improve motion, and also the longevity of the system. So this is a trend in 2003. FDA approved reverse in USA, and the numbers of reverse arthroplasty increasing after the FDA approved, and the numbers of anatomic shoulder replacement and hemi dropped significantly. In Australia, 2019, they found that about 80% of shoulder arthroplasty is reverse in Australia. So in Germany, the numbers of reverse also increasing together with the complications of the surgery. This is the overall trends of the world. You can see that it's increasing the numbers of reverse in many parts of the world. And also there are so many designs of prostheses right now. So what about Asia? So this is the numbers in Thailand. You can see that the number increasing in Thailand, also Asia increasing, and like many other countries of the world. So until now we have 3 companies available in our country. So I'm not sure about India and also the Korea. So this is a summary of the Southeast Asia countries. The reverse arthroplasty is available in only 5 countries. Simple Biomed is also available in 4 countries, including Thailand. Now we are talking about the controversies and unsolved problems and the future trends. Our Asian people, the size of the implant is the problem, especially the glenoid. So our most common problem of Asian people is the small glenoid component. because this prosthesis at the beginning is designed for the US or European people, so it's not designed for Asian people. So many times it's not fit to the Asian people because we have smaller size glenoid. So this is a study from Thailand comparing the size of the glenoid. So we found that our study, the AP diameter is only 24 comparing to 29 from United study. This is the study from Professor O from Korea. He also found the same results. Asian population have smaller size glenoid morphology, large acromion index, and bigger critical shoulder angle. Same result in China, and about 41% of female glenoid width is less than 25 in China. Same result in Japan. So due to the smaller size of the glenoid in Asian population, we have very narrow margin of error. Okay, but luckily the Zimmer Biomet is the only one company that concern this point. So that's why it's become very popular in our country, because it's the only company that can provide the smallest size glenoid component, 25 millimeters, smallest humeral tray, 40 millimeters, the humeral stem increasing every 1 millimeter, available humeral tray offset, and available short stem. So the Zimmer Biomet in Thailand is the most popular. So we're talking about the complications. So the future trend is to reduce the complications, the possible complication from reverse. So because of the expanded indication of reverse nowadays, they can do it in fracture, in tumor, in fracture sequelae. So when the complication is also expanding, like the expanded indication. So depending on the complexities of the case, especially the fracture sequelae and the complicated bone loss. So three most common complications of the reverse is the scapular notching, instability, and the infection. The glenoid component malposition is the beginning of the complication. It is the main cause of the complication that produce humeral instability and early failure. So I think the glenoid component is the most important key factors how to solve this problem. So the new technologies nowadays, we have computer-assisted surgery like computer navigation or patient-specific instrumentations. So I have tried the navigation system, and I found that I didn't like it because it's not user-friendly and also a lot of pitfalls. So that's the study comparing the patient-specific instrumentations and navigations. This is a meta-analysis in 2019. They conclude that the navigation system doesn't help to improve the version or inclination further, but the PSI significantly improved the glenoid version and inclination. So this is one of the patients. She has severe glenoid bone loss. You see that? Very big bone loss. So if you do surgery without any navigation or PSI, it's impossible to do the surgery in these patients. So you need the patient-specific instrumentation, good design, and good pre-op planning. You see lateral version, 46 degree is a lot. So we can do the 3D printing and can do the surgery in saw bone first. And you can use this to help you in the theater, okay? So this is the benefit of this PSI, patient-specific instrumentation. This 70 years old captatrobody with bone loss. So he has a severe bone loss with severe lateral version of the glenoid. So this patient, I did the patient-specific instrumentation. So this is an in-house technology. Okay, so we have the engineer team working with us. Okay, and we found that the result is pretty good. Yeah, we can solve the problem of the glenoid severe lateral version using the PSI. So the recent meta-analysis found that the PSI had significant improvement in glenoid version and inclination error. The accuracy of this PSI was 1.2 degree, and the accuracy of the glenoid version was 2.6. So the conclusion is that the use of PSI glenoid base plate guide is highly accurate. So should we use PSI for every patient? So some surgeons also concerned about the extra cost or the cost effectiveness using the PSI. I myself use PSI not routinely. I use it for the patients that have very severe case, revision case, or severe glenoid bone loss. So the trends and controversy of the reverse. Okay, we're talking the trends nowadays one by one. So the trends of the fracture proximal humerus reverse becoming more and more popular nowadays. Okay, so in the past we did a lot of hemianoplasty, and we found that there's a lot of failure of the hemianoplasty because you need to deal with the gator tuberosity. So it's proof for many literatures that the result of the reverse is much better than hemianoplasty and lower complication and better shoulder outcome. So the new controversy is that when we do reverse shoulder arthroplasty in young shoulder fracture, it's generally not acceptable because the young patients, we try not to do the reverse. Okay, so we cannot avoid this surgery in some patients that have a very severe fracture or fracture sequelae, multiple revisions. Okay, so in my practice, I also did some in a very young patient. My youngest patient is 45 years. Okay, so this is the literature. They did the study in 4-part fracture proximal humerus. So the age varied from 27 to 80. The average age was 68. The youngest one is 27. And they found that the result of reverse in the young is also good. Okay, but anyway, we need to wait for the long-term result. Okay, so the trend of the reverse in the young population become more popular in many countries. So in some countries, they not accept, like Japan, you cannot reimburse if the patient younger than 75. Okay, so many times they need to do like SCR or total shoulder with SCR in Japan. So anyway, the result and longevity of the reverse is getting better over time. In these literatures, they found that 3% decrease in the risk of revision with every 1 year increase in age. Recent systematic review found that the patient less than 65 years of age had the similar complications and reoperation revision rate, same like the older patients. So how about reverse shoulder arthroplasty in osteoarthritic patients with intact rotator cuff? In the past, we did not accept this, right? We need to do anatomic shoulder replacement. Most recent literatures, JSES 2021, they just published this year about the reverse in primary shoulder arthroplasty with intact rotator cuff. They conclude that the reverse had better short-term outcome and low complication rate comparing to the anatomic shoulder replacement. So this is the literature about the B2, B3 glenoids. Yeah, they prefer to do the reverse shoulder arthroplasty in this kind of patient, even the rotator cuff intact. Okay. So how about the subscapularis repair? This is also the controversy and the trends. Subscapularis repair is controversy. So repairing the subscap may improve the stability, improve the internal rotation, and decrease external rotations. But it is a controversy issue. So subscapularis act like the adductor because the center of rotation change after the reverse is shift inferiorly. So repairing the subscapularis may against the shoulder abduction. And it's based on the design of the shoulder prosthesis. The medialized system, they recommend to repair the subscap. For the lateralized prosthesis, may not need to repair the subscap. Okay, so the recent recommendation for the lateralized prosthesis recommend to repair the subscap if there's minimal tensions to allow the soft tissue coverage and decrease the dead space, okay, and reduce the hematoma formations. So if the repair is too tight, so it may change the shoulder mechanics and worsen the clinical outcome. So that's my approach. If I repair the subscap, if there's no tension in neutral rotations. So taking home message for this reverse and the trends, reverse is still increasing popular, okay, in the nowadays and in the future, and there's extent indications. So the computer-aided design and also complicated navigation, PSI, may improve the accuracy of the reverse shoulder arthroplasty. So the controversies and challenges still out there waiting to be solved. Thank you.